Elbow pain can come from tennis elbow, golfer's elbow, ulnar collateral ligament injury, especially in the case of a baseball pitcher, or it may come from osteoarthritis. This is a very simplification of the elbow pain. So let's start with tennis elbow. Whenever we grip something, we are using both the flexors and the extensors because the wrist is a flexible joint. If we just use the flexors, it will fall forward. So at any time when we're doing the grip, we're using both the flexors and extensors. And if we have something like carpal tunnel syndrome, then there's carpal tunnel syndrome with decreased sensations, and then we overuse the strength and we get tennis elbow. So tennis elbow can do very well with regenerative medicine technique. All you do is you palpate the area, and if you see significant tenderness there, you have tennis elbow. We can do PRP or PRP with growth factors. Especially we can do growth factors if there is amniotic allograft, if there is tearing of the tendon on the MRI scan. If the patient also has carpal tunnel syndrome at the same time, in that case, we can do carpal tunnel block with platelet-rich plasma and the and growth factors with or without. PRP is enough usually. I'll just do PRP for the carpal tunnel. And we can do PRP with or without growth factors for the tennis elbow. This way you've addressed one of the contributing factors, that is carpal tunnel, that's making us overuse the strength and this thing. And if the patient has a habit where they overuse the strength, you try to fix it so that they'll tend to use the hands softly, whether working on the computer or working out or whatever. And if they soften up their movement patterns, that'll help keep the improvement long term.